So now let me talk a little bit about a topic that people really want to find out a lot about, which is fibroids and fertility. One, is uterine fibroid embolization an option in these patients? Initially, when we started doing this about 20 years ago, the answer was unequivocally no. We didn't know what the procedure would do to future fertility, and we just shied away from even considering it. But what happened as we started seeing excellent results from patients with this procedure is we were getting patients from gynecologists who had high surgical risk, they had other medical problems, they had already had a myomectomy, and they had recurrent fibroids after the myomectomy, which can happen in about a third of patients, or the patient just was very against having a repeat surgery such as a myomectomy, or there were so many uterine fibroids that the gynecologist would tell us, look, if I go in to try and take out all those fibroids, I'm going to make Swiss cheese out of your uterus, and the likelihood of you getting pregnant, let alone me being able to take care of them, would be very low. So then we started offering the procedure in very careful and selected cases. Slide's not advancing. Okay, so when we talk about options for patients who have fibroids, have symptomatic fibroids, and are also interested in future fertility, here are the two options. One is a myomectomy, as we've talked about, and then the other is actually a uterine fibroid embolization. So when I boil down the results from this data, we see that in all the different research trials that have been done with uterine fibroid embolization, there's about a 60% cumulative pregnancy rate after fibroid embolization, and that's actually very similar to the pregnancy rate in patients who've had myomectomy. The difference being is that the uterine fibroid embolization is a much less invasive procedure and definitely has a much shorter recovery time. And we've seen similar clinical outcomes. So patients who are having heavy bleeding or pain, when they have either procedure, they do get better. And as I just said, there's definitely a shorter recovery from the fibroid embolization procedure. We also see that there's a higher recurrence rate of uterine fibroids after the myomectomy. Now, we also have seen in these trials that there may be a slightly better reproductive outcome with the myomectomy, but if it is a repeat myomectomy, that's definitely not the case. And a lot of interventional radiologists out there, both in research papers and also, anecdotally, will report successful, viable, and healthy pregnancies after this procedure, and all of us who've been doing it for a while definitely have seen that. So what do we tell patients? We tell patients that if you have uterine fibroids and you have symptoms and you are interested in future fertility, we're going to individualize what's done. Not everybody is a candidate for a myomectomy, and not everybody is a candidate for fibroid embolization. So if patients have very few fibroids, they're very easily accessible for the surgeon to remove, then generally we will recommend a myomectomy. Certainly if there's a recurrence after surgery or multiple uterine fibroids that might be either difficult to resect or the patient is a high-risk patient, then we'll consider uterine fibroid embolization. And then there's a large number right in between these two, and after a lot of conversation with patients, we share the data, we share the experiences, we individualize what we're going to do.